everybody. Good evening. Thank you all for coming to learn a little bit more about infertility and IVF and what options you may have. I'd like to introduce myself. My name is Allison Lottis, and I work at WSOC TV Channel 9. I'm one of the anchor reporters there, and I personally had a struggle with infertility, and my husband and I were patients at REACH, like many of the people in this room and many of the people on the panel. And so if it wasn't for the wonderful doctors and nurses there, we would not have been able to have our daughter Hope. And her name is for that reason, that we were very hopeful. And I hope that the same will happen for all of you who are hoping to become parents too. And tonight we really just want to provide information to you and let you leave this evening feeling empowered and educated about what options you may have for treatment in the future. So I'd like to introduce the panelists this evening. First off, we have to thank Samantha Busch for really being vocal and an advocate for this subject and her personal story. And so Samantha, I'd like to introduce you first.
Yeah, well, thank you guys all for coming. It's so amazing that all of you reached out, and to see all of the orange in the room, it's great. So for those of you that don't know our story, my husband Kyle and I, we tried to get pregnant naturally for a good year or plus, and then we ended up going to our OBGYN, who finally diagnosed me with PCOS. And then we got put on all sorts of fertility medications, and that still wasn't working. And little did we know that my husband also had an issue. And so after going through all that, they referred us to REACH, where the amazing team there, we went through the whole IVF process because they said that was the only way that we would be able to have a child. And it was very successful the first round. We had our son Brexton. He'll be 4 on May 18th. But after having him and seeing how hard emotionally and physically the journey was, we also realized the financial piece. And what's really frustrating is that insurance doesn't cover a lot of it. A lot of couples come out of pocket almost $20,000. And so with that, we decided, Kyle and I did, to start the Bundle of Joy Fund. And that was started, and to date, we've helped 37 families. We have 19 babies through the fund. We have 4 more on the way throughout this year, and we're getting ready to do another round of grants. So even though the journey didn't start or go as we planned, we're very grateful that it did, because we're very honored to be advocates and speak up for such a cause that even 6 years ago when we were trying, many people didn't talk about. So thank you guys all for coming tonight, and please feel free. We're excited to answer all of your questions and help you through this journey.
And next I'd like to introduce Nina.
Hi everyone, my name is Nina Glass, and my husband Jarrett and I went through infertility for about 4 years. We underwent multiple procedures. We did many of the Clomid drugs. We tried everything from eating the pineapple core. Yeah, you guys know about that one. We did vitamins, everything you can think of, and then we were told that we would need to do IVF. I didn't quite ovulate always on time. My husband had male factor. And we were facing just a huge financial burden to be able to do it. But then in May 2017, Kyle and Samantha walked in our lives and gave us a Bundle of Joy grant. And now because of them, we have our beautiful son, Rocco.
I'd like to now introduce Michelle.
Hi everyone, I'm Michelle Sublett, and my husband and I went on a almost 6-year infertility journey. We started with some of the same drugs, Clomid, letrozole. My doctor determined that I had PCOS, so I wasn't ovulating. And we did happen to get pregnant a number of times through Clomid, IUIs. We even did IVF. We had the PGS testing, did 2 frozen embryo transfers over the last few years, but both failed. One, I didn't get pregnant, and then the second one I miscarried. Then we proceeded to have 2 natural pregnancies that were surprises, but I miscarried both of those times as well. And the doctors never really knew what was going on, but they thought maybe chromosomal problems, because we did have a few of the embryos tested after I had a couple D&Es. So our last frozen embryo transfer was in December, and it actually was successful. So I am 21 weeks pregnant now with our miracle baby. And oh, I should have mentioned I was at CMC at the Women's Institute as well. So And I tried all that stuff too, the pineapple, the bromelain, Robitussin, legs in the air, you know, it's, there's everything. So hope this gives you all a lot of hope.
Next, I'd like to introduce Dr. Katz.
Hello, my name is Seth Katz. I'm the medical director at REACH. I'd like to give a special thank you to Samantha and Kyle for your generosity and your passion and your openness about this process. It's just amazing how many lives you've impacted in such a positive way. It is an arduous journey, but you know, in the right hands, more often than not, it's going to be successful. So feel free to ask any questions you have tonight, and we look forward to answering them.
And last but not least, Teal.
Hello, everyone. My name's Teal, and Teal Taylor, and I am the laboratory director at REACH, so I am the baby maker. And I also want to thank Samantha and Kyle for everything you've done to just shine a light on infertility. So look forward to the discussion, and please, any question is open. So
We have some prepared questions that we're going to go through, so we hope to just really educate you on the process, and then from there we'll provide y'all with an opportunity to ask some of your own. The first question will be for Teal and Dr. Katz. Can you give us an overview of what the IVF process entails from start to finish?
On a very high level, this is after all the preliminary things that one would probably have gone through before they got to the point of doing IVF. But at a very high level, once the decision is made to do IVF, you'll sit with your physician and a plan will be made. And then the IVF cycle is basically two parts. It's a stimulation phase where the ovaries are stimulated to produce really as many eggs as we can get from that cohort that month. And then there's a suppression phase that keeps the ovaries from ovulating so that we can control the cycle. So that phase, those two phases last about 10 days. And on average, on day 12, you undergo a procedure where you're put on sleep and we go in vaginally to retrieve the eggs. That day, those eggs are fertilized. And from that point on, I'm going to give it to Dr. Taylor down there to explain.
So the physician basically creates the eggs, and what he'll do is he'll take a long empty needle, it'll just suck out the eggs from the ovaries, and then he gives it to us. And what we do is we will clean your eggs, and we'll examine your eggs, and then those that are, for lack of mature, we take an empty needle and we will attempt to fertilize it. So we'll inject one single sperm into a single egg. And then we'll put them back in an incubator, check them in 24 hours, and then we know how many embryos we have. And then we just leave the embryos in basically a warm refrigerator, and we leave it in there for a few days, let them grow, and then we select the best ones for transfer for freezing.
And while I have you,
Yeah.
I might as well ask you, when you're selecting the best ones, what are you considering when you're selecting the best ones?
So a lot goes into it. So the patient age goes into it, but essentially it's a beauty contest. You look at it and you go, this looks great, let's freeze it. So there are a variety of things you look for that we can dive further into. Or if you do genetic testing, we look to make sure it's normal, chromosomally normal, and then we go from there. But a lot of the embryos don't even make it to that stage. You're looking at about 50% will drop off, and we'll discuss that later on.
Okay. Samantha, then I'd like to start with you for the next question. Anyone who's heard of IVF has probably heard of shots. So can you explain what that means for a patient, and when are you taking them? How many are you taking? What's that like?
Yeah, so I don't do needles at all, and that was the hardest part. Kyle and I actually Ryan right there, filmed our first night of shots before we even considered talking about it. And I was hysterically crying as Kyle lined up all the medicines, all the needles. He made me leave the room and go to the living room, and I was just sobbing. And there's a video, and I'm clutching our little dog, and then he started doing them, and honestly, I was cried through the whole thing though when he was done. I was like, okay, that really wasn't that bad. You know, it's more mental than anything. There are some shots that they kind of hurt, but you over time realize that there's different things you can do, like progesterone and oil. You put that in your butt. It's not fun, but if you warm it up and you kind of massage the area, it helps. If you ice before doing the stomach injections, it helps. But I would honestly say for all the gentlemen in the room, being able to do that for your partner, that was something for me as just emotional and crazy as I was during that time. Kyle took all the medicines and he lined them up and he got them ready and he administered them, and I felt like we were really a team, and it made it a lot easier on me for the process.
Nina, is there anything you'd like to add?
Yeah, a lot of the same things. Jarrett was actually the person, my husband, that gave me the shots, and it is very beneficial to have someone there that you can't possibly, because it just allows you to relax. So I did the same thing. I would just lay on the couch, put a favorite show on, and we actually did a little trick of he didn't count down to when he was giving me the shot, so I would just be relaxed, and that helped, alleviate some of the pain. I did icing to help as well. Like Samantha had my dog with me. So anything that you can do to alleviate just the worry about it, and it really isn't as bad as like some make it out to be. A lot of the needles are very similar to acupuncture needles. But yeah, the husbands just be there for your partner as much as you can.
Dr. Katz, for you, can you explain the importance of staying on a schedule for the injections? And does that increase your chances of success or for harvesting more eggs? And what side effects do people experience from the shots?
Okay, so the main shot is FSH. It's a peptide hormone that is metabolized quickly. So it's in and out of your system pretty quick. So if you don't take them on a regular basis, then you lose the effect of that medicine. And that's very important in the beginning of the stimulation. As the ovaries and the eggs start growing, then it becomes a little less critical because they're kind of on autopilot at a certain point. The side effects, bloating, that's the primary one I hear. Nausea, probably you guys would be better at this than I am, but nausea, it can trigger headaches, and it's really a function of the elevated estrogen level that comes from stimulating the ovary. So as the estrogen level skyrockets, then all those symptoms kick in. And it, in some ways it mimics early pregnancy.
Next question is for Teal. So we've talked about what goes into prepping your body for harvesting the eggs, but then once you have an embryo and you're ready to transfer, can you explain that process and what is recommended? 1 embryo, 2 embryos?
Yeah, so we constantly fight about this actually, but rest assured our goal in IVF in general's goal is a single healthy baby. Just 1. Anything more than 1 is a high-risk pregnancy. So twins, that's bad. And there's been a very large push in the industry, mainly from insurance, saying we can't transfer 2 anymore unless it's warranted. And so typically the first round, the first treatment plan is to always transfer 1. And that typically will result in a pregnancy rate anywhere from 60 to 70%. So it's very successful. When you go for the 2, you think, hey, I may be increasing my chances to 90%. No, you're not. You're really only increasing your chances by about 2 to 5%, but your multiples are going up to about 20 to 30%. And then that's where the problem is. That doesn't mean we won't transfer 2. It just means the first line of defense is 1. So in our practice for the last year, we've probably been 90% single embryo transfer, and we've maintained a pregnancy rate of about 70%. So there's really no benefit in transferring 2, unless we really get to, get down into the nitty gritty of you clinically. But yeah, we will transfer 2, but we just don't take it very lightly.
Dr. Katz, is there anything else you'd like to add on that?
I was the last holdout for 2 embryos. I'm the one sitting across from the patient, and they've gone through, years and years and spent thousands and thousands of dollars. And so at the time they get to IVF and they're ready to try, I mean, having two is like more bang for your buck, right? I'm done, get two, and so it's been a learning curve for me to appreciate some of the higher risks associated with a twin pregnancy that are quite significant. And you only need 1 or 2 patients who lose their pregnancy at 22 weeks because of twins and premature labor and delivery that to really make you appreciate how much better it is to have one healthy pregnancy in there. Having said that, I still get my arm twisted a fair amount and put 2 in on occasions. So it's not a line in the sand, but like Teal said, it is our primary initial desire to put one in.
Thank you. Many of you know, because you're in this room, that the struggle to have children is not only a medical one as far as challenges go, but there are a lot of emotions involved too, and also finances as well. So I'd like to start with Nichelle. You shared a little bit about your IVF journey, but can you talk about how you handled all of the emotions, how it affected you personally and publicly, and if you have any advice that you can give?
Well, I'm going to be honest, I'm not sure I handled it so well over the last 6 years. I think in the beginning it was, we're going to make it. Oh, it's just 1 miscarriage. Okay, we'll get through that. Okay, it's 2. But by the time we got to 4 and 5 and things just seemed really bleak, I won't lie, it's very tough. And there were times that I was in and out of depression and just really not understanding why. I know one thing that really helped me was support groups, and there's several here in Charlotte, so I would encourage people to reach out to those groups because just talking to other women who have been through this is like amazing. It's the best therapy. And then also I was seeing a therapist, and she specialized in women who had been through infertility. She had gone through infertility herself as well. So I found that was really helpful. And I'd say the third thing that really helped me was being public, actually, about my journey. I was not public for many years, but then I had the fortune to compete in a pageant and win Mrs. North Carolina last year, and I made infertility awareness my platform. So I started posting and sharing pictures and personal stories about our journey. And while at first it was very, very scary to let people know that we had this, big secret and this flaw, I guess, in our marriage, ultimately it was so healing. There was so much support. So many people were able to wrap their arms around us and pray for us and just really rally behind us. And so, not saying you have to go do a public post or anything, but I would talk to your family and friends about what you're going through, because honestly, they can't really be there for you if they don't know what's going on. And they may keep asking insensitive questions about when are you gonna have a baby or what's going on, because they don't know. And so I just find that educating people on that helps so much. I mean, just the transparency, it was like this huge weight was lifted off of me, and I think my husband as well, so.
And some people may feel embarrassed or that it's not socially acceptable to talk about, but there's not really any shame in having to go down this path. Samantha, what would you like to share about your experience?
Yeah, I would say when we first started, we were kind of excited. We were very young, very healthy, never thought it would happen to us. And so because of that, I felt that I wasn't my own advocate. I didn't push for answers. I just kind of went with the flow. When people said, oh, you got to wait at least a year. Oh, wait a little longer. Oh, try this. I had no idea that I could just simply make an appointment and go to Reach. I thought that was a referral process. And so I think educating yourself the best way you can, like she said, reaching out to support groups and people that have gone through it, that's really key in going through this journey. And then definitely the telling people. We, during our first try with Brexton, we were very secret until we got through, and I think he was probably about 14, 18 weeks when we very much opened up about our journey. And I wish I had done so sooner because you feel very isolated, you feel very alone. There are moments of depression. You start avoiding your friends because they all have kids. You stop going to baby showers. You cry every time you look at Facebook because somebody's pregnant. You compare yourselves to them, and it's so hard. But what I've learned through all that is that's natural, and it's okay to feel that way. It's okay to grieve for what you're going through. And I think that's the hardest part, because as a woman, you already feel like you're less of a woman because you can't become pregnant, and then you see all these other people, and it's just very emotional. And I wish that when we had originally gone through it, I would have reached out to more people, because as we all know now, it's 1 in 8. There's so many people on the same journey. So I think just finding those support groups and being there to empower and strengthen each other is what we have to do.
And we want you all to know tonight that you are not alone, although sometimes you feel very lonely in the journey, that you're not. Teal, you mentioned a little bit when we were talking about the embryos and what you look for, but you mentioned genetic testing. Can you explain what exactly that is, how it works, and the information that you provide couples with?
Yeah, okay. So biology 101. We all have 46 chromosomes, theoretically. I mean, some of us may have, sure, it's fine. But, so we all have 46 chromosomes. And unfortunately, humans are really very poor at reproducing compared to other species. We are just the bottom of the barrel. So even if everything goes right from your cycle to the time into fertilization, there are still so many hurdles that have to happen. And it is believed that, if you look back at the scientific literature, a majority of miscarriages, a majority of, embryos not making it in culture, embryo death, are from chromosomal abnormalities, which basically means instead of 46 chromosomes, it may have 45, it may have 47, it may have 52. It's really all over the map, and it's a completely random event. And if you don't know, and some chromosomal abnormality, a majority will miscarry. However, some do still make it to term. So trisomy 21, for example, Down syndrome, that's a chromosomal abnormality. Basically, what we'll do is, in order to screen for these abnormalities, we'll culture the embryo out to day 5 or day 6, and we will use a laser. And we'll take a small piece, about 5 cells, off of that embryo. That embryo is about 100 cells. So we remove about 5% of it. And there's data showing that that doesn't impact anything. We will freeze that embryo and we'll label it number 1. And we'll send that sample off to a genetics lab and we'll label that sample number 1. So then we'll get a report back saying, hey, number 1 is abnormal. It has too many chromosomes. And then number 2 is normal. So that way when you come through for a frozen embryo transfer, we can pick the embryo that is normal. And if you look back at the randomized controlled trials with this science, it shows that the pregnancy rate is extremely high. So even in over 40-year-olds, you're looking at about 60% pregnancy rate, which is really good. And the miscarriage rates are reduced with this. It's not 0, because there's still many other factors that are involved, but it certainly gets rid of a majority of the reason why miscarriages occur.
And Samantha, do you want to share anything about your experience with the testing?
Yeah, so by the time we had tried and gone through IVF, or thinking about going through it, we had learned about genetic testing and that it did help greatly reduce the chance of miscarriage and everything. And just the emotional state that I felt like we were in at that time, I don't think I could have emotionally handled that if something had gone wrong. So we had chose to do genetic testing, and with Brexton, it was a huge success. He's a healthy, happy, almost 4-year-old boy. But with our last one, we tried a few months ago for a girl. Same genetic testing, same batch, if you will, as Brexton was in, and it did not work. So it's definitely, as you mentioned, it helps. It's not a guarantee, but I'm a huge advocate for it because, as you mentioned, it does help with the success rate. But you're holding up a 3.
Number 11 to 8. There was 11 to 8 through genetic testing.
Oh yeah. So thank you. We sent off 11 embryos to be tested, and 8 came back healthy. So had during the first round, one of the 3 that we would have lost through miscarriage happened. I just don't know if physically, mentally, emotionally, I could have picked up the pieces after that. Because here with a healthy son and after everything, I don't feel like I've picked up the pieces yet from what happened this winter, so.
Dr. Katza, and for you, this is a topic that patients need to weigh heavily. So how do you approach the subject of genetic testing with patients?
Yeah, it's, the consults are now spent talking about genetics more than ever used to be. I've been in this field a long time. And now I spend at least half the time talking about genetics of embryos, what you can test for, what you can't test for. I think it's a very individual decision. And, here's the responses I hear when I bring it up for discussion. Oh, well, we would transfer no matter what. We wouldn't do anything. I'm like, okay, but a miscarriage is a significant thing to go through, both on your body and emotionally. And if you knew you could prevent that, is that something you would think about doing? So to me, the real value of the genetic screening is in the reduction in miscarriage risk, because 85 to 90% of those first trimester losses are due to chromosomal abnormalities. And you drop, depending on age, you might drop the miscarriage rate from 40 to 50% down to 5%. And that's the value that I see.
We'd like now to offer an opportunity for any of you to ask questions. So I'll just ask if you raise a hand, and I'll gladly come to you and allow you the chance to ask our panel anything. Does anybody have a question?
Yes, ma'am. I always have questions. Hey, Dr. Cass. I have 2. One is, I've gone through IVF been in this process 4 years. I'm probably one of the older people in the room. One, how big of a factor is age, because I am over 40? And then 2, does the medicine really have to cost that much? Does it cost that much for it to make it, or is it just because they know we desire to have it that they can charge those outrageous prices?
We need a pharmaceutical.
That's such a loaded question. You do not want to get me started on it. There's basically 3 companies in the world that make fertility drugs. And so, it costs them pennies to make it. It's recombinant technology. Once it was developed, it's literally pennies to make. It's just in a lab, and they can mass produce it, and there are some really rich folk from those drugs. It doesn't have to be that expensive, but until you get some kind of huge group to bring the cost down, patients have no clout. The other thing that's really interesting is, without getting too much into insurance questions, but when physicians negotiate with insurance companies, we're told what we'll get from the insurance company for a procedure. But somehow the drug companies get whatever they want from these insurance companies for the drugs. So what we have to be aware of is patients can use their entire benefit on the medicines and have nothing left for the procedures because they're charging these outrageously full-price retail prices to the insurance company, and it wipes out the whole benefit. So I don't have a fix for that, all right? They sit there. And so if you're 42, those eggs have been in there 17 years longer than when you were 25. And things happen to them, and they get fragile. And the parts in the egg that are responsible for dividing normally, they break and they crack and they don't work as well. And that's what leads to the chromosomal abnormalities, and that's what leads to the higher miscarriage risk. So it's not impossible, it's just harder.
Staying kind of in that lane, what if a patient was older now but had frozen eggs earlier? Is there any more concern that they are
No.
able to carry
the eggs don't age in the tank. So that is a plug for freezing eggs when you're early 30s, because the eggs don't get older once they're in cryopreserved. And the uterus works great regardless of age. So if you can take a 25-year-old egg/embryo and put it into a woman who's 65 years old, and it'll work great, they'll have a baby. Now, should you do that? No, but you can. So yeah, and nothing, we try very hard to improve the quality of eggs as you get older, but it's very hard to do. It's very hard to do.
Does anyone else have a question?
Hi, I have a PCOS question. So how does that affect the IVF process? Like, is there anything you need to do prior to starting, or?
I think that's you. I can answer that. He has the non-medical side.
Yeah. So from the medical side, women with PCOS have a lot of eggs, but there are oftentimes some egg quality issues. So you get a lot of eggs, and then there's usually a big attrition rate as the embryos grow. As far as preparing, yeah, I mean, I'm a believer in, despite how I look, in staying away from anti-inflammatory foods like gluten and dairy. I think that anything that inflames the gut can inflame other organ systems. So I think that can be helpful. I think metformin, which is a diabetes drug that we use in women with PCOS, can be helpful in some situations. I think myo-inositol and sometimes low-dose steroids are all part of an attempt to kind of maximize the environment that those PCO eggs are growing in.
So on my personal level, I'm now on my 4th cycle of the IUI. My second one did come out as a chemical pregnancy. My question is, so the doctor thinks that we should continue going this route and then maybe possibly going to letrozole before we go to IVF. And then my next question for the ladies is, if you were in that situation, I mean, obviously at some point, how long do you wait before you just say, enough with the IUI, when do I finally take the next step?
Did you guys do IUI?
I did, yeah.
So we did one IUI, and that just had a very low chance of taking just because of the sperm count that we had. And we were pretty much told right away that you're going to have to go do IVF. I think it was something, looking back, I would have tried because it is a much lower cost, and plenty of people have it happen. But that's where I just really relied on my doctor and trusted in them of what the best next step was, and I really think they're the best to lead you on the right path.
Yeah, we were told to do 3 of each thing, so we did 3 Clomid cycles. Well, no, we did 2 Clomid cycles because I got pregnant the second time. But then we started doing letrozole. We took a break, started doing letrozole. We did 3 cycles of that, and then my doctor recommended we move on to IUI. We did 4. She recommended 3, but we did 4. So what they told us is if it doesn't work within 3 times, you might want to let it go, just because at the same time, then as a woman, you're aging, and so maybe you move on to the IVF. But it's a personal preference, I think. I think it's, a 17% chance or something, yeah. So it's a lot less than IVF, but the cost, yeah, it's a lot cheaper to do IUIs.
Can I walk in front of you?
So I went through a similar experience that Samantha did in March. And I guess my question for the 2 physicians would be, what can you do to help increase your egg quality when you've not been told anything is wrong with you? So there was no PCOS, labs are all normal, but we also had a 4AA PGS tested embryo.
That didn't work.
Pass that down there.
Well, so, I mean, listen, that's a tough situation when you have a chromosomally normal embryo that looks beautiful and the uterus looks appropriate and it doesn't work. So at that point, there's a lot of different options, okay? And none of those options are perfect. And so it's not necessarily about making the embryo better. At that point, we start looking at other things. Like, could there be an inflammatory process affecting the uterus? Could there be some process in the blood that's decreasing the chance of implantation? We're just beginning to learn about all the factors that go into implantation. It's still kind of a black box. And, but there's now several tests available to further delineate what's going on in the uterus at the time when an embryo is trying to implant. And so looking at some of those tests might be an option. Honestly, sometimes you just have to try another embryo, and it works. There's an element, nobody wants to really admit this, but the science isn't perfect. And there's an element of randomness to the entire process where everything looks good on paper and it just doesn't work. And you know, you didn't do anything wrong, the embryo just didn't find its spot and didn't keep growing. And so sometimes you just need to give it another try, and it makes all the difference.
Okay, thank you. I also have Samantha, did you have
I was
another?
going to add just to that. I think especially after going through that and having a genetically tested embryo, you almost come down harder on yourself of what did I do? Because it had to be me, right? And you question what you ate and your workouts and what you did or didn't do constantly to the point that you drive yourself crazy. And it wasn't until we had gone back a few weeks later and we were doing a Bundle of Joy grant, you and I were in the hallway and you said, it doesn't matter everything that we do scientifically, it doesn't matter if you have the best doctors in the world, the guy upstairs is the one who gets to decide. And that stuck with me so much just because of your profession and everything that you do, and it kind of at least helped a little bit take the weight off knowing that, you know, like you said, you chose what you thought was the best embryo, and I did everything in my power. I ate right, I did everything the book said, and sometimes it just doesn't work. But knowing that, and I'll say it to you even though many days I don't feel it, just knowing that it's not your fault, and for some reason God always has a plan for us, and even though we can't see it, one day we will.
So I look at it, I look at it the same, but you know, your situation, unfortunately it's common, but you know, you're making eggs, which is a start, that's good. You're making embryos, so you get fertilization, and you're making blastocysts, and you're making normal blastocysts. You know, that's a lot of the pie already. We just have to figure out when is it gonna work. You know, so it's, unfortunately it is random, but you also could not be making eggs, or you could not be making blasts, or you could not be making normal blasts. So now that we know that, it's just a matter of we need the chips to fall in your favor.
I was gonna say I had one thing to add because like both of you, I had 2 that failed that were PGS normal, and it was just like mind-blowing. But we did an ERA test, and I know I guess the doctors could speak to that. They said that I was pre-receptive, so I needed an extra day of progesterone, and they did that the next time, but they also switched up some other things in my protocol. I tried the gluten and dairy-free. I tried so many different things. I'm not really sure what it was, probably God's timing, but yeah, I know how rough that is as well when you have genetically normal.
And then I have another question. I guess it's kind of along the lines of insurance, the insurance industry. And Samantha, I know you're very passionate about lobbying for infertility coverage on a national level, but I wasn't sure if there was a lot of knowledge or a look into the insurance industry and covering the PGS testing. Because if you look at insurance payers and what they're responsible for covering for the lifetime of a child, and if you had a child that was born with a disability, you know, would it be worth them paying the $2,000 to $3,000 to have the PGS testing done and covered versus risking a pregnancy that, you know, with a child born with a chromosomal abnormality, and then the expense that goes into caring for that child for the remainder of their life?
That's a no-brainer. Yeah, but insurance doesn't work that way.
But yeah, even just a miscarriage is, I mean, it's a lot of money to take care of that from their standpoint. If you could reduce that, you'd think, I mean, they know the data, they have the data, so, but, you know, their mindset is to try not to pay for things first, and then only when pushed to pay for it. And so when you approach things from that angle, I don't know, it makes it tough.
And I want to add, so through getting Bundle of Joy, I wanted to do something in return, and I know I don't have the financial means to just give back the cash value, but I kind of started a new career, and I'm now working with a Fortune 40 company in their HR department. And everyone keeps mentioning insurance. The main key that we can start doing is going to your employer's HR department and demanding that they start adding this coverage for their employees. Because it is a huge recruiting tool. A lot of times companies have found that it does decrease costs when they work with companies like Progeny who monitor these situations, do the embryo testing, because when couples are self-paying, they do try to do the multiple embryo transfers. They can't afford the testing. So I just encourage people to start looking out that way as well. And employers, if you're in any type of position, at your employer to do the same, you know, really look into one of these companies because it can be cost saving.
Yeah, it's very frustrating. I mean, obviously we're very happy with the Bundle of Joy Fund, but for every 5 or 6 couples that we get to grant, we're turning down 40, some of them, because the cost is just so astronomical. And so what we're trying to do now is work with groups like Progeny, and they actually have a thing on their website that you can go and start the questions to your HR department, because it covers egg freezing and IUIs and IVF, and we have to start there, and we have to speak out about it, because that's when the change is going to happen. And I feel like when we band together and show people that we are a community, we deserve coverage. These costs are ridiculous. No couple should say you can't become parents because you don't have $25,000 just laying around. And it's very frustrating. We're slowly trying to figure out what we can do to make those changes. And the more you learn about insurance and politics, I think the more frustrating it gets. You know, we've currently learned that for some veterans, they get coverage if they were wounded, but not if they weren't. How do you tell somebody, oh, thank you for fighting for our country, but I'm sorry, if you want a family, you weren't hurt, we're not going to help you. I mean, there's just so many ridiculous things that we're starting to learn about, but it really takes people banding together, speaking up, going to their employers, you know, joining support groups, and having a voice. And I think when we come together and have that voice, we're going to make big changes.
Anybody else have a question? Start here at the beginning.
I have a question about genetics. So I am PCOS and type 1 diabetes. So is it obviously recommended to go through and do the extra homework with that and go through the extra tests just to, I guess, would it be more factors? Having the, I guess, your regular genetics with that, or is it? I'm in the beginning phases of this. We're going to be going through IUI whenever I finally get started with all that. So I'm in the beginning phases of that. So.
Yeah, I mean, there's not a universal opinion on this, okay? So I would say from the diabetes standpoint, no. There's not a reason to do genetic testing just for that, because you're not testing for diabetes. So you're not helping the embryo out from that. And the miscarriage risk from diabetes is not with the chromosomes, okay? From PCO, that's a little more complicated because there is an egg quality issue that may be chromosomal in some cases, and so that may be a valid reason to test the embryos. But it's not universal, clear-cut. I still think some of the age and your journey and kind of where you're at, and you know, like Samantha was saying, you know, if reducing that miscarriage risk is important to you, then yeah, test the embryos, because that's your best shot at doing that. And it's not perfect, but it is your best shot.
I just didn't know if there was anything, again, just to kind of better help that with dealing with that, because I'm recently diagnosed with both. So I'm kind of new to that journey and new to obviously all of this. So
Yeah, there's actually not a huge literature on type 1 diabetes and infertility. So, I mean, they're mainly case studies, so I don't think there's a problem related to that specifically. There's some really controversial stuff coming down the pike, though, in terms of what you could actually look at in these embryos, which is kind of crazy going forward. But genetics is the brave new world. I mean, and I would love, in some ways, to put it back in the box, but it's out, and we're not stopping it.
Hi, so someone like us are going through IVF in about 2 weeks. We are learning all the acronyms and everything, but can you explain the 4A, B, 1, 2, 3, like all that?
I don't know what that is.
Try not to get hung up on AA, AB, BB, BC, CC, 4, 3, 2, 1, okay? Try not to get hung up on that, because there are plenty of times where you transfer an AA and it doesn't work, and you transfer the BB and it works. So, and there's also what I grade as a BA, maybe the person next to me will grade it as an AA. You know, so there's a lot of subjectivity there as well. But the most important thing is that you have a blast. You have a viable blastocyst. Everything else doesn't really matter. You know, there may be a 1-2% increase in pregnancy rate, maybe, but I have yet to see a paper that says, especially if you do genetic testing, it's irrelevant, it's normal. But I have yet to see a paper that says, hey, we didn't do genetic testing and we compared pregnancy rates between AAs and BBs, and we found a 1% difference. You know, so don't get hung up on that. Get hung up on how many embryos you have frozen.
And what do the numbers and letters mean?
So 1, 2, 3, 4 on the left-hand side, on the very first 1, 2, 3, 4, is just what stage it's at. So it'll be blastocyst, expanded blastocyst, hatching blastocyst. The higher the number, 4 is the max, the further along it is. But again, one's made plenty of babies. You're freezing it because it's good. The second is a ABC. Maybe sometimes they throw in a D. Think of it like grade school. You know, A, B, C, D students. A's are your superstars. You know, C's do fine. But that is grading on the scale. That is grading called the inner cell mass, which is the actual fetus. So that's your actual baby, and it's just saying, A, hey, it looks great. B, it looks good. C, it looks okay. The other one on the end is going to be your what's called the trophectoderm of the placenta, and those are the cells on the outside. And again, just A, it looks great. You know, but it's don't get hung up on it. Don't get, because a lot of patients will, you know, they'll be like, I want that AA, and I've seen that AA transferred and it not work, and you just, you know, and then you think, oh, I had the best shot. Now that BB's not going to work. Well, no, it doesn't work like that. So just focus on how many you got.
Well, I'm sorry that we can't get to more of your questions, but I do want to allow you all to have one final question to answer, and that is, if you have one piece of advice, especially for the women up here, that you wish you would have received before you started this process, and then for our doctors, is there one piece of advice you have for people before they start, or if they're in the middle of the IVF process? I can share my mic if anybody wants it.
My piece of advice is the lab takes it just as hard as you do, so we take it just as personally. When things don't go right or don't go as expected, it's not ideal for anybody. And so we feel like we've done something wrong. So it's not just, hey, I've done something wrong, it's we've done it also. So we're right there with you.
I would say before I started the journey, I thought that IVF was just, okay, it's gonna work the first time. It works for everybody, it works for celebrities, you know, it's not gonna be an issue. And I wish I had known to be maybe a little bit more patient with the process of realizing just because it didn't work the first 2 times didn't mean it was never gonna work, because I think for a long time I got that into my head. And so I just wish I, trusted more and had more hope during that wait, as opposed to thinking, okay, well, something must be wrong with all 7 of our embryos because 2 didn't work, So just try to, put it in perspective and be happy for the things that go right, because I didn't realize that even having embryos was like a really big deal. So, yeah.
I think just one thing I would have done differently or advised people on is just love yourself and love your partner during this. This is probably one of the hardest emotional, physical, everything roller coaster that you're ever going to go on, and it tests who you are as an individual, as a woman, as a husband, as a partner, and it's not easy. And so, you know what? There's going to be days that are going to be bad, and there's going to be days that are going to be good, but you have to just love yourself throughout all this, because it's very easy to come down on yourself or to come down on your partner, or to place blame and to fight and to just really get into a really bad area. And so if you need to seek out a therapist or a friend or a support group, whatever you have to do to just make yourself during this whole journey feel whole and feel loved and feel supported, do that. Don't hide. I remember times of just avoiding people, avoiding family, avoiding friends, avoiding social media because it just hurt too much, and just isolating yourself, and that's not the thing to do. Going through it the second time, we announced on Thanksgiving Day that we were pregnant, and then 1 week later we had to publicly announce that we miscarried. And as hard as that was, I'm very grateful we did it, because the thousands of messages from women who understood those pain and emotions and those feelings are what made it a little bit easier to get through. And so, just reach out to people, because anybody who's been in your situation would love to help you.
Kind of like Samantha said, we were isolated as well. We didn't really tell anyone. And once we received the Bundle of Joy grant, it was like this huge weight off our shoulders, because not only the financial aspects, but everyone knew. And I found myself in like almost a reverse role of people were now coming to me to reveal, hey, we're about to go through this. Can you give me advice? Can you, help me through this? Even at work now, like I'll have women come up to me that say, if I'm miscarrying, like what should I do? How should I go about IVF? And also, I want to see, I'm looking out at you guys, and I'm seeing myself 2-3 years ago, and I see the emotion in your guys' faces and the hardships that you're going through. And the best thing that I think my husband and I did is every month we decided to give ourselves something to look forward to that was completely unrelated to fertility or to IVF. And it's financial burden too, so it would be something small, just going to the park for the day, or out to lunch at our favorite spot. But just take care of yourselves. When you are going through it, prepare as much as you can, even if it's meal planning. Just take the burden off where you can. Don't underestimate what it's going to do to you physically. Try to take those days off work. My first embryo transfer was fresh, and I was at work the next day and actually went to another job interview. And I look back and I'm like, I was crazy. Why did I do that? So the second one, we actually did the transfer, and we just went to the beach for a few days, and we just stayed completely relaxed. And so I just encouraged you to look after yourselves and try to do things away from fertility to keep the strength that you have.
Just from listening to the stories, the 2 things that come to my mind are perseverance and don't lose hope. The single biggest reason that couples stop trying is that they lose hope. It's not the money, and so I would encourage you all to understand that this is a grind, and I tell you, if you persevere at it, it does make a difference. It really does.
And Samantha, is there anything that you'd like to say as we close this evening?
Yeah, I just want to thank everybody for coming out here. As I had mentioned, we're a community of support and love and empowerment, not only during National Infertility Week, but every week. And so I encourage you guys to share your stories with each other and connect with one another. It makes the world a difference. And we'd also like to invite you guys, obviously after this, to join us out on the patio, where we're going to light up the city orange in honor of everybody's journey. And we're just grateful that you guys came out and could be a part of this. And again, we're here for you for whatever you need. So thank you to everybody. And thank you to the amazing panel for sharing all of your experience and coming out tonight.
Thank you all for being here with us this evening. As Sam mentioned, we're going to get a photo that's going to be here around 7:45-ish. I'm not sure what the time is right now, but if you want to go to the bar, grab a drink, join us out on the patio, we'll get that photo momentarily.